From waterfront regulations to healthcare delivery. This time, Governor Babajide Sanwo-Olu has declared that Lagos has reached a decisive phase in its ambition to shift from high malaria burden to pre-elimination status, and will do all it takes to completely eliminate malaria from Lagos State.
To formally come to the bank now, unveil this pre-elimination launch of malaria from Lagos State.
In March 2025, the Lagos State government launched the Pathway to Malaria Pre-Elimination and Digitization program to reduce malaria prevalence in the states. 6 months later, the state government is holding the mid-term review of Pathway to Malaria Pre-Elimination to analyze the progress of the health project.
We see here that within the CP, we had, by our data, we had the parasite confirmed rate of 4%.
Lagos State's Commissioner for Health, Professor Aki Abayomi, provides a detailed scientific account of the state's malaria data trajectory, revealing that Lagos is now firmly in pre-elimination phase with prevalence around 1%.
Our data is showing that our prevalence has dropped dramatically. This reflects a dramatic decline over the last 5 to 10 years. And we're now hovering in the 1%, which means that Lagos is now either above the pre-elimination or in the pre-elimination phase. In the last 6 months, we've been testing, and we've tested 40,000 Lagosians in 6 months in this informal sector, which is mainly the PPMVs, the CPs, and a few PHCs. 40,000 tests of people presenting with what they believe is malaria. So typically they would go into these pharmacies or these PPMVs and they wouldn't even give their complaints. They would just say, I have malaria, treat me. And sometimes they'll say, I have malaria, give me anti-malaria, and just to be sure, give me an antibiotic as well. And so that used to be the practice. But when we went in and we started to test people who were walking into these pharmacies, we found that only 5.6% of them actually have malaria by rapid diagnostic test. Most of the patients presenting in Lagos with fever is not caused by malaria. 94% of all fevers is caused by something else. Only 5 to 6% is caused by malaria. So we have a new terminology now, and it's called malaria negative fevers. And so Lagos must now learn to treat malaria negative fevers, because that is the data that we're finding.
With the record achieved so far, the World Health Organization WHO says it is willing to offer technical guidance on global best practices that will help eliminate malaria in Lagos.
We will be together until we reach the vision of malaria elimination in Lagos.
For the Coordinating Minister of Health and Social Welfare, Professor Ali Pate, who joined virtually, it describes digital integration of community pharmacies as a game changer in bridging the gaps in Nigeria's healthcare system.
This achievement represents a significant milestone in our efforts to bridge the gap in malaria service delivery in Nigeria. PPMBs and CPs, who are often the first point of contact for individuals seeking medical assistance, have now been equipped with the necessary training, tools and resources to effectively diagnose, treat and refer malaria-negative cases to health facilities.
Governor Babajide Sanwo-Olu says Lagos has shifted from high malaria burden to pre-elimination status and must be sustained.
This impact project funding and the technical support have been instrumental in extending our intervention to the hard-to-reach areas and incorporating private providers into our efforts. And so we understand and appreciate that government on the public sector side cannot do it alone. We'll continue to incorporate the private providers on this effort. However, we must ensure that scaling up doesn't compromise quality. But we all need to keep up the momentum. This is not a time to clap yet. It's really just another call for action. It's a time for us to stop, to analyze, to review, to critique ourselves, and to see what are the verticals and what are the various things that we need to do quicker and faster to ensure that we do not lose or stop the momentum. And so today's midterm review should provide us a solid operational plan for the next quarter, by identifying the hotspots for increased surveillance, by retraining the schedules of our private providers, by the metrics to track and test before treatment adherence, and a timeline for full integration that will ensure that our data into the state health dashboard, we do not lose or miss anybody out. And so to my fellow Lagosians, this fight is just as much as yours as it is mine. Every little action counts, whether it is getting rid of the standing water, which is some of the things we were discussing in the next room, using treated nets where needed and where necessary, to even getting tested before taking any anti-malaria drug. This simple test can lead us into significant positive changes. Let us set an example for our health workers by testing, recording, and treating properly, and by reporting. If each of us play our parts, we will make the great strides. A great stride towards eliminating malaria and reaching a point where it's no longer a common issue in our states.
Emphasis on tests before treatment continues in the state to prevent misdiagnosis and drug misuse in order to assist Lagos move from pre-elimination to full elimination of malaria.